My name is Humphrey, Nabimanya, founder and CEO of Reach A Hand Uganda. For the last 15 years, Reach A Hand has transformed ideas into practical things. And some of those things have transformed generations of lives of young people. It has transformed my life. And I reflect on the challenges I had to where I grew up from, that I used to walk about 20 kilometers going to the next health facility, but also ride a bicycle about 50 kilometers to the main hospital in Mbarara District town. And for me, that was a reflection on what young people were going through on a daily basis, that even up to now, they're still going through the same issues. My mother, I remember, and the stories they told me, I was given birth from the kitchen, because at the end of the day, there was no emergency to travel to a nearby health facility that could do a proper delivery for me. All my brothers and sisters have gone through the similar situation. And I might say that we are happy that we're alive. We are happy that our mothers did. They had a lot of traditional birth attendants that were available at that time that could support them. But imagine a mother today. What is that mother going through today? What is that mother who is in the same situation like my mother at that time going through today? We no longer have a lot of birth attendants into our communities that are supporting your children, my children, our daughters into our communities. What about the boy child? Going through a lot of issues, going through a lot of challenges to where he can get care for his own health, to where he can get care and consult about his own reproductive health care. We are really struggling and also having so many challenges like that. Young people in different ways are properly shamed because they cannot address their reproductive health challenges. They're not attended to well, and that's why you find that many are saying that clinic, that hospital are not giving out youth-friendly services. And those are some of the challenges that we have faced in the last 15 years with our work that we're doing in different communities that are not any different from where Humphrey grew up from, his brothers, his sisters, his nieces, his friends that I grew up from. They're not any different from you and me. But look at so many rising health issues that have risen up from COVID-19. Look at about the mental health challenges that we are having, the non-communicable diseases that we are having. They're all affecting our young generation. And also why am I mentioning about the young generation? Because Uganda has the youngest population in this country. But Reach A Hand dreamt. We had a dream that would start a youth health facility that is going to provide quality health care. And we are happy to say that in 2020, the board and the Reach A Hand management team sat down to make sure that that dream is a reality. As I speak right now, 5 years down the road, we have the Reach A Hand first community health clinic that is serving the people in Kempungu village and the nearby community in Mbarara, Uganda, Bwizwera, everywhere. And majority of those are women, majority of those are young people, majority of those are men that are able to access quality health care from our facility. And that's why the dream came to reality. To enable my mother, today's generation, to be able to give birth in a nearby health clinic, not able to walk long distances, to enable my sister, my brother who's HIV positive to be able to access medication with a lot of ease, with no difficulties, the way my sisters and brothers used to face those difficulties accessing for medication. To enable consultation so that you can be able to access that facility. But what have we also added on? Being a young organization that is serving young people is to make sure that also youth-friendly services are enhanced through livelihood programming. We have also enhanced our nutritional benefits by establishing community gardens at the health facility. This is a dream that we are still dreaming. A dream that we want to see Reach A Hand establish 10 health facilities across the country that are having all these elements that are dealing in skilling, providing health care, providing nutritional benefits, but also doing programming around the different communities and different regions where these health facilities are going to be placed. We're so proud of the Mbarara team, of our Western Region team, that has done tremendous job, that is able to provide family planning services to the people that need it, that is able to provide even family planning services for the men that need it, that is able to provide a standby ambulance that is able to even support in connecting you to different health facilities that can give you that service. We are proud for our partners, for our board that has made this dream come into reality. And we are growing it not only alone, but working with you. Because I want to serve my mother that distance, so that our future generation can even serve more mothers from walking that distance in a painless journey, to make it a calm journey and a happy journey for them, so that your brothers and sisters can have a happy life, knowing that they were born in a comfort, knowing that they've been able to grow up in a comfort, they've been able to be taken care for in a comfort. So welcome to the Reach A Hand Health Facility that we're going to grow together, me and you. To our partners and our board members, to our team, we thank you. And thank you for supporting us and continue supporting us.